Okay, it's not necessarily nerves, not necessarily caught, which means a joint, yeah. Where does the impingement happen in this group that we're talking about? Yeah. The scapula. Let's try something else. Yeah.
Under the acromion?
Underneath the acromion. That's the key. It's this space. It's the subacromial space. And there's lots of things under that space. So what's under there? Supraspinatus tendon, biceps tendon. There's a bursa. There's a joint capsule. So we have a very small space right where my finger is. Okay. All these vulnerable structures. And the impingement is when somebody lifts their hand, what starts to happen to my finger? What are these two bones doing to my finger? It's pinching it. It's literally pinching. Okay, that's what an impingement is. So we have two ways that we can test for that impingement. One is the Hawkins test. The Hawkins test you can do sitting. You want to position the arm, shoulder and forward flexion. And then the true test is you internally rotate. So it's forward flexion with internal rotation. And what you're going to get is watch your patient's eyes. You're going to get that pain response, or they might pull away from you. It's usually, an impingement is a sharp pain. And you might ask your patient, what are you feeling? It's pinching, it's stabbing, it's sharp. I mean, that's Hawkins test. Okay? So in you and I, it's an uncomfortable maneuver, but we're not getting that sharp pain unless we have an impingement. So it should feel uncomfortable on all of us because it's putting us in an awkward position. It's putting us in an impinged position. Okay, yeah?
Will they just in that position?
It's a little bit of overpressure into internal